speakers. We've been working for, I should say, about a year now to make this webinar a reality, and again, I'm very excited about the content today. We are going to be joined by an innovative practitioner that's making a real difference in her community, along with the hard work of the City of Manistique, Schoolcraft Memorial Hospital, the Sault Ste. Marie Tribe of Chippewa Indians, and the Manistique area schools. We'll hear her story in a bit here. We are also going to hear from the magicians behind the County Health Rankings website, which, if it's a tool you don't know yet, I'm very excited that we're here today to introduce you to the County Health Rankings website. So to go through today's presentation, make sure this is advancing, I want to just tell you what our objectives are for the day. We want to make connections between the RuFES Action Framework and health. We see health as a critical component of helping families earn more, keep more of what they earn, and grow what they keep into assets over time. We want to share this Manistique story to illustrate how a small place, a rural place, can really act for better health. The story that we're featuring today has been received a number of recognitions in the field of health, and particularly the prestigious Culture of Health Prize from the Robert Wood Johnson Foundation. Today we want you to hear how it started, where they're going with their work, and how maybe you could start replicating work like this in your community. We also want you to learn about the countyhealthrankings.org website, which I think is a fantastic resource for communities that are trying to learn more about themselves and what they can do to make a difference for the health of their residents. Like all data sources, we also want you to be able to understand its limitations and where possible, get around them. So today we will be joined by Kerry Ott, who comes from Manistique, Michigan, and will tell you the story of her community and the work they're doing. Karen Odegaard is joining us from the University of Wisconsin Population Health Institute, where she is a coach that helps communities that are dealing with or addressing health challenges in their places. And of course, my colleague Kristen Feierabend, who's going to be our technical go-to guru for this hour and a half, is there and available to help you address technical issues, and I'll give you her contact information if you are having any technical issues in a second. And again, I'm Travis Green. I'm a program associate here at the Aspen Institute Community Strategies Group. Today our agenda is we're going to start with the Mighty Bold Manistique story. We're going to hear from Kerry about the work that they're doing, and we'll then end with that story with a question and answer period where you can chime in and ask any questions that you might have of Kerry. And then we're going to turn to the Rural County Health Ranking, or the County Health Rankings website, and Karen to walk us through how you pull your numbers from that tool and then what you can do with the information you learn. And of course, we'll end that period as well with some question and answer from the participants. Just quick notes on participation. I just want you all to know you're not hearing each other because you're all muted right now. We're just doing that to minimize annoying noises that can frequently come in on webinars. If you do have any questions, and this is, we really like a participatory structure. There's a couple dozen of us on a webinar, so go ahead and chime in the question control panel has a place to put in questions. If there's a clarifying point that you need clarified during the presentation, just go ahead and put it in there, and Kristen will help us identify those and make sure that they're read out loud to everyone. As for big questions or ahas or maybe stories, hey, I've done this in my community too, we'll have a question and answer period after each of the sessions where you can speak up with those. Again, if you have any technical problems, please go ahead and email Kristen so we can address those and make sure that you're connected and able to hear these great stories. So a bit about the RuFES Action Framework before we dig into the presentation. And just so some of you may not have heard about the RuFES Action Network before, but the RuFES Action Network is based around 3 family-oriented action goals. It seeks to help families earn more, keep more of what they earn, and to grow those assets, to grow what they keep into assets over time. So there is a full action framework available on our website, rufes.org, that can outline for you strategies and action items that you can do in your community to help move the needle for rural families. Today's presentation focuses on some of the sub-goals in that framework, specifically Earn It Goal 5, which is about workers, and in this case students, having reliable, affordable, efficient means of transportation to their jobs and schools. We'll hear about how rural communities can do walking and bike transportation too. This is not in all rural areas have to be cars or buses. We are also going to touch it on Keep It Goal 4 and 8. Keep It Goal 4 is about reducing debt burdens, and as we said in the alert advertising this session, healthcare costs are the single highest cause of bankruptcy in the United States, and having a healthier community is going to help address debt burdens in rural areas significantly. And Goal 8, families have ready access to affordable goods and services. We're going to speak briefly about how Manistique is building a farmer's market that gets their residents access to healthy foods at an affordable price. And then also, I think it's hard to go through any rural story without touching on Grow It Goal 6, which is about family members participating in their community on these types of efforts. And we will definitely hear in Manistique how this was a community effort that helped move the ball. So just a last notes about the RuFES Action Network. If you are interested, we're an action network of 1,200 practitioners from across the United States, come from CAP agencies, CDFIs, United Ways. You can learn more, again, by going to our website at rufes.org about the network. And currently members hail from 49 states. Everybody asks what one state is not represented, and I don't believe we have anybody from Rhode Island. So I'll just answer that question right up there. Again, please visit our website, rufes.org. We're tweeting. Our handle is AspenCSG, and if you tweet something with rural families, we will retweet you. We encourage you to look through our action idea repository at our website to find stories like this one that we're going to feature this morning. Again, it's coordinated by the Aspen Institute Community Strategies Group, and this webinar would have not been possible without the support of the Annie Casey Foundation. We thank them for their support, and let's dig in. So Kerry, are you on the line?
I am.
Hello. So I'll hand over to you. Again, Kerry comes from Manistique, Michigan, where she works in the health department now, but we're looking forward to hearing your story. So just tell me when you're ready to advance, and I will do so.
Okay, I can't see the slides yet, so there we go. Perfect. Welcome to very rural Manistique, Michigan. It is a late autumn here this year, which is unusual, but it is beginning to look very much like what's in that picture. And I'm glad to have this opportunity to tell you a little bit about our story. Next slide. Now you may wonder, where in the world is Manistique, Michigan? Well, if you start in Detroit, you're going to drive north about 300 miles on I-75 to the Mackinac Bridge, one of the largest suspension bridges in the world. Then you're going to go 88 miles west on US 2 along the northern shore of Lake Michigan, and there you will find Manistique. Next slide, please. Our assets. Our location. We're in a beautiful spot. We have a lot of forests, and obviously the Great Lakes and the inland lakes and the rivers. It affords a great deal of recreation and beauty in our area. In our town, collaboration, people and agencies and businesses working together, often with different end goals in mind, but knowing that the process they've chosen can get them to the same location. Challenges, our location. We are very rural. We have a declining population. We are facing a lot of business closures. Recently, one of our largest employers in the community closed down. And there is competition between communities in the UP to attract new business and families. And so it's a challenge. We get a lot of snow. It's a long winter. And it can be a difficult place to live. So we have both assets and challenges, and we try to make the best of what we do have. Next slide, please. All right, we have a population of 3,010. That is a loss of 16% of our population since the year 2000. Manistique is the county seat for Schoolcraft County. We are also the only incorporated city in Schoolcraft County. Schoolcraft County is the fourth largest county in Michigan geographically, but we have a frontier designation of only 4 persons per square mile. 70% of our land is owned and managed by state and federal governments. We have Hiawatha National Forest, Sandy Wildlife Refuge, and other areas that are all run either by the state DNR or by the U.S. Forest Service. So Manistique is surrounded by water or trees. We are an hour from the next largest town, which is a town of 10,000 people. So we are very, I'm trying to paint a picture for you on how rural we actually are. Next slide, please. So what inspired the work that we started in Manistique? Well, the Sault Ste. Marie tribe of Chippewa Indians, which is based out of the Sault Ste. Marie area here in the Upper Peninsula. They got a tribe from the Centers for Disease Control. They got a grant, the Strategic Alliance for Health grants, and they picked 4 communities in the UP where a lot of tribal members live, and Manistique was one of those communities to implement that work. City of Manistique was a key partner from the very beginning with this work. We did community planning between the tribe and with them, and ultimately we came up with 2 initiatives that all partners agreed were most important for our community, and I'll get into what those 2 were in just a minute. And that is our lighthouse, about 2 blocks from my house, out on Breakwater in Lake Michigan. That is a view I get to see every day, so one of the reasons I like it here. Next slide, please. All right, other partners that were vital to the work that I'm about to tell you about. Obviously the city, the tribe, the LMAS District Health Department, which is where I work now. I used to work for the Sioux tribe. The hospital, Schoolcraft Memorial, has been a key partner in this work. Manistique area schools, Parks and Rec, Schoolcraft County Chamber of Commerce, Head Start, Early Head Start, Radio Results Network, Pioneer Tribune, that's our local paper, comes out on Thursdays. The Manistique Kiwanis Club, local farmers, our MSU Extension, and volunteers. Next slide, please. So we picked 2 health initiatives that we decided to try to work on in this rural community. The first thing that everybody said they really thought we needed was a farmer's market. Manistique had not had a farmer's market in over 50 years. Some efforts had been tried, but none ever came to ever actually having a farmer's market. So we decided to take a year in planning and see if we couldn't make this happen. Obviously, we have a very short growing season where we live, and Schoolcraft County in particular has very bad soil for large farms. We just don't have large farms like you're going to find in areas such as Traverse City, Michigan, which is in the Lower Peninsula and is a wonderful area for all kinds of agriculture. We have bigger challenges. We have a lot of rock, and so we had to find smaller hobby farmers and see what we could come up with. And we took a year to make sure we did it right. One of the things we learned from other markets was that people didn't like going to farmers markets where there was nothing but crafts. So from the very beginning, we set out that our market was going to be farm and food only. We would not have craft vendors because they have so many other places where they can sell that. We wanted to focus on getting people access to fresh, locally produced foods. The pictures you're seeing here, the two along the top, that is from our very first farmers market. We ended up inside our ice arena because it was pouring down rain that day. So our very first market, we had 6 farmers and 300 shoppers. 10% of Manistique's population came to that first farmers market. And we were only going to do a test market in 2010. And by the end of that market, the farmers had all sold out. The farmers and the shoppers convinced me that we needed to have more markets that year. So we scheduled another 5 markets right through September that year. And it was a glorious beginning. And mostly it was just tables in a parking lot, or inside the arena, depending on the weather. But it was a fabulous beginning to our first ever farmers market. Next slide, please. Since 2010, we did an economic impact study on the market because the economic side of this work is very, very important to the Chamber of Commerce, local businesses. Where we were looking for health benefits, they worked alongside of us because they saw that there could be a really, really important economic impact through this healthy communities work that we were focusing on. So we did an economic impact study, and we found out that persons who come into Manistique specifically to shop at the farmers market, while they're in town as a group, they spend an additional $5,000 at other area businesses incidentally while they're in town for the farmers market. That was huge data to be able to show our city government and our local businesses, especially in the downtown area, which is very close to where we have the farmers market. Next slide, please. In 2012, we were able to make some improvements to the market by applying for a USDA Farmers Market Promotion Program grant, which we got, and we still use our sandwich board sides that sit on the corners on market day, which you see on the left. One of our farmers painted that. But we also, every year in the spring, our city puts up banners that we were able to get with the grant all over town, just to let people know that if it's Wednesday, it's market day in Manistique. And so we were able to improve our signage a little bit. But those sandwich board signs on the corners, they do a lot to bring people in as well. So next slide, please.
Carrie, this is Kristen. We have a question from Janet. She was just asking a clarifying question. Is the $5,000 figure an annual figure or a cumulative over the years?
It's every week.
Every week, every time they come to the market.
Wednesday, we have a farmer's market for 2 hours on Wednesdays during the season, 4 to 6 p.m. And while people are in town, they come to market specifically to come to town for the market. When they are in town, they stop, they get groceries, they go get gas, they eat out, they go downtown. In mass, every week, average $5,000 at other businesses.
Got it. That's great. Thank you.
Yeah, I was kind of blown away by that. I love that number. It made me very happy. So with the USDA grant that we got, we also were able to provide our farmers with a little better infrastructure at the market. As you can see, the canopies, we got better tables that were a lot easier to manage, and they fold in half, and they're very sturdy, but they're also very easy for the farmers to handle. When the first day we put the canopies up for the market, the mayor of Manistique came and stood in the middle of the market. He was talking to me, and he said, "It's like you've created a real business here." And I said, well, that's what we've done. It's temporary. We only put it up on Wednesdays, but that's exactly what it is. And as you can see, the market's very popular. That bottom picture on the right, that's the lineup, and that's pretty typical all season long. People start lining up half an hour before we open, and before we ring the market bell at 4 p.m. And it's just, the editor of the newspaper here said to me, I didn't think you'd get that many people to show up once, let alone getting them to show up weekly, year after year during the market season. And they keep coming. The people of Manistique, they wanted this, and they love the support they're giving our local farmers and getting fresh, locally grown and produced foods. It's huge. It's been really huge. Probably the most significant thing I've ever done in my career in public health. It's just been phenomenal. So next slide, please. I could talk about this all day long. And I just put this in here to let you know a temporary place can make a big impact on a community. That's a very typical scene on a Wednesday during the market season. We open in mid-May, and we usually run through September, depending on how the harvest has gone for our local farmers. We also have eggs and honey and locally grown beef, and it's a fabulous 2 hours. We average 300 people a week in those 2 hours, which is a phenomenal a bit of data for something that's gone on. We just finished our 6th season. So, all right, next slide, please. Our other initiative that we took on was improving non-motorized transportation. And I just put that other picture there to show you we do get a lot of snow here. So we have a boardwalk along our lakefront, which is about 2 miles long. And but we had a lot of issues with sidewalks and snow removal. Made it very challenging for people to get around town. A lot of our sidewalks actually would end in the grass, which if you are using a walker, in a wheelchair, pushing a stroller, that makes it very difficult to cross that street. One of our things that we participate in every year is the Team Manistique, the community challenge between communities in the UP. Has happened 6 times. Manistique has won the last 5 years, competing against many communities in the UP, and the people of Manistique have really embraced using walking and bicycling modes of transportation. And when the community challenge starts in the summer, they are ready for it, and there's no stopping them. I'm very proud of them. And that's just a small glimpse of what Team Manistique looks like in this community. So next slide, please. We were able to secure funding for infrastructure through the Safe Routes to School program. We knew that was going to be probably the easiest way to find grant money for this particular infrastructure. And the next couple of slides, you're going to see some before and after pictures, and this is just a few. Next slide, please. As you can see, the sidewalk previously stopped in the grass in both directions, and once we got the grant and were able to improve, we actually improved 14 intersections in Manistique so that they were fully ADA compliant, meaning every direction, no matter which direction you were crossing from, had the ramps and the bumps. It was all in place. 14 intersections in a town as small as ours has a big impact on people's ability to get around. When the sidewalks were installed in 2013, it was a total of 5 miles of new or repaired sidewalk infrastructure in the city of Manistique. That wasn't all Safe Routes to School money. The city had signed on to the concept of complete streets, and they wanted to be a more walkable community for all residents. And so while we focused, the Safe Routes money had to be in a certain radius of our elementary and our middle school, the city decided that they wanted at the same time to improve the sidewalks on the other side of town. And even though economically time was hard, they found that money, and so they also added to the amount of sidewalks we were able to put in that year so that all the neighborhoods would have walkable sidewalks that were safe and easy to get to. This picture right here, this is my favorite spot in town. I called it the goat path. It ran from a housing project to the middle high school, and there was no sidewalk there. And you could see obviously where people wanted to walk because they did, but in the wintertime they were all walking in the street, which that is M94. It's a street in town, but it can be a very busy road with trucks going through on their way across the UP. We didn't want our kids and our residents walking in the street, and so that sidewalk meant a lot to me when we got that one in. And since then, the city has also bought equipment and have made a commitment that they make sure that all the sidewalks that are safe routes to school are cleared whenever we have more than 2 inches of snow. They make sure those sidewalks are clear for our kids in our school and our residents as well. All right, next slide, please. Now, how did we do this? Part of it was learning how to and knowing how to access grant money. In 4 years, we were able to secure more than $500,000 in grants, which goes a really long way in a small community. We also have been annually assessing our community through the Promoting Active Community assessment tool from the Michigan Fitness Foundation. We've won copper. We've won bronze level twice, and this past year we won the silver award. We're going for platinum, which carries a financial prize with it. No one in the state of Michigan has won platinum yet, so we're kind of shooting for that. We were the first community in the Upper Peninsula designated by the State Office on Aging as a community for a lifetime. And of course, in 2013, small but mighty Manistique won one of the inaugural prizes from the Robert Wood Johnson Foundation. In 2013, it was the Roadmaps to Health Prize that is now known as the Culture of Health Prize. But we were most honored. Our 3,000 population community, the next smallest community that won that first year, had 88,000 people in it. So we were very, very proud, and it was someone from the foundation that actually named us small but mighty, and we really like that a lot. So we continue to use that. So next slide, please. I show you this picture because this picture was our community interview when the foundation folks came to see us. And what you see represented here are people from the tribe, from the hospital, from the senior center, from the elementary school and the high school. A person who works for a playground equipment company is there. The retired city Parks and Rec director is there. The mayor was there, the city manager, the health department. Our director of Head Start and Early Head Start was there. It takes, in a rural community, you have to get that wonderful mix of all these different people. With our Chamber of Commerce was there, all these people working together to make these changes that impact both the health of the community as far as what we would traditionally call health, being able to walk and access to healthy foods, but also the economic health of, the impact this has had on our local farmers at our farmers market has been phenomenal. They did not have an outlet where they could sell out week after week in just 2 hours time their produce that they had ready for that week, and that makes a big difference. And obviously the market's having an impact economically on the rest of the community as well. So it's amazing what you can do when you all come together. Next slide, please. I love this quote from Margaret Mead: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has." I have never seen that in such real form as I have in the last 6 years that I've been working here in Manistique. And our greatest asset, I mentioned our assets earlier, our greatest asset are our people working together, creating a stronger, healthier, growing Manistique. It's a phenomenal group of individuals and agencies and businesses all working together to improve our community. And next slide, please. And that is my contact information. If anybody wants to contact me later with any questions, I love to talk about this work. I think that's just a list of grants and other resources that we used and continue to use through this work that we're working on. Okay, I think that's it, Travis.
Kerry, thank you for sharing that story with us. And just so everybody knows, we are creating a web page for the story at rufes.org. All of these resources will be linked there, as well as a video of this presentation. So if you want to share it with others. And now we have a few minutes for questions about this Manistique story before we go on to part 2 and hear about the County Health Rankings website. So if you have a question and you'd like to ask it out loud, go ahead and raise your hand, and we will make sure to unmute you and so you can chime in. Or if you rather use the chat box, you can type your question in there, and we will read it out loud for the group. And I'll go ahead and start with a question while folks are thinking of their questions. This is such a great presentation, and partly because I think that there are so many people that think that the things that you tried are so hard to do in a small community. Particularly, I think the walking paths. You know, the idea that you'll do something in infrastructure, to me, just always strikes me as something so expensive. Can you tell me a little bit about how the community, when they were deciding to do something about health, just got past that sticker shock of saying, "Oh, that's something we can't do in our place"? How did your working group kind of say, "No, this is something we want to do, and we're going to go figure out how to get the resources to do it"?
Well, it's funny, the belief that we could improve our concrete infrastructure for walking was not where the pushback came from. Everybody believed that we were going to be able to finally proceed, get the safe routes to school. We were going to be able to make that happen.
So that it wasn't a barrier for you?
No, that wasn't. It was the farmers market.
Okay.
I actually had a person on the farmers market work group who, that whole year of planning, kept saying to me, "You cannot get a farmers market started in Manistique. You will never make it happen." I'm like, okay. He reminded me a lot of my older brother, and so I just said to him, I said, "You know what? I realized that other efforts have been tried and failed, and I just would say to him, I said, you didn't have me before, so let's try one more time." I don't like to be told I can't do something. So he is now our biggest champion and has eaten crow at meetings I know across the state. He has stood up and publicly said how much he dogged our work, and now how proud he is of the work that we did, because he never thought it would happen. There's just been, it was an interesting, that was not where I expected the pushback, because I thought it would be the infrastructure. But the city was so on board because we needed them. Their engineers that they work with, it's an agency a couple hours from here. Our city doesn't have an engineer, but they worked with us on that Safe Routes project. The schools worked with us, and it really was, that was the easy part. Oddly enough.
Travis and Kerry, I noticed, this is Janet, I noticed Jason Gray in North Carolina has written in a question saying, oh gosh, I had it here a minute ago. So how much income for farmers was generated? Are there more farmers involved now? Are they growing different crops at higher value since this has all started?
That's a great question. We started with 6 farmers. We now average about 15 farmers a week of various sizes. One of our farmers that started with us from the beginning had such foresight that, wow, this is really good. The people really like this. We need to plan ahead. And so in 2011, they actually planted 800 crowns of asparagus, which grows pretty good here in the UP. But it takes a few years before you can harvest. They also found some apricot trees that do really well. They're miniature trees, but they do well in this climate. And so they had the foresight to increase what they had to offer. They had a lot of strawberries, but they needed, they wanted to expand that so that they could meet the need and the want of the customers. What we average on gross income is between $75,000 and $85,000 annually at the farmers market. And then each of our farmers then, they, depending on what they have to offer, they have a variety of economic impact. We also take the Project Fresh coupons, which are provided as part of the SNAP program to low-income seniors and moms who are on WIC, the Women, Infants, and Children program. And so that's an additional income stream for our farmers. We really are hoping next year to implement taking the bridge card, the food stamp card. I'm not sure what it's called in every state, but in Michigan it's called the bridge card, so that people could utilize their food stamp benefits at our farmers market. That's something that, we're completely voluntary, and that's a little bigger program to manage, but we're hoping to make that happen as well.
When we had talked earlier, Kerry, you had mentioned that there were some ways in which the town helped you all increase traffic to the market, and something that they had done with their transportation system. Can you tell that story?
Yeah, are you talking about our public transit?
For seniors, I believe.
Yeah, the public transit used to close. It's basically a dial-a-ride system, but would stop running at 5 o'clock. And our market runs from 4 to 6. And they expanded that time so that families, seniors would have that opportunity to attend the market and still be able to order.
Gary, do we still have you?
I'm here. I'm not sure what that was.
Neither do I. Go ahead.
The other thing is that goat path that I showed you in the picture with the sidewalks, that actually ran right in front of where we hold the market. And so now we have walking infrastructure in place as well that gets us, that allows people to walk and more safely ride their bike along that somewhat busy road, that M94, to get to the farmers market as well.
Wonderful. Are there any other questions that folks want to bring up? Janet, I didn't see that one from Jason. Perhaps there are others coming to you, or I just want to make sure that folks have the opportunity to ask questions.
He just typed it in the question box rather than the chat box, that's all.
I see.
So we're going to move on to the county health rankings now, correct?
Yes, wonderful.
Great.
So we're being joined by Karen Odegaard from the County Health Rankings website, the Wisconsin Population, I think I'm getting this right, Population Institute?
Population Health Institute.
Population Health Institute, thank you.
No problem.
And I'll share the screen with you. One moment while we...
Okay. Okay. Well, thank you so much, Travis. And I just have to say, Kerry, I love hearing your story. I always learn something new when I listen to Kerry talk about the work that has happened in Manistique, and I think that it's really inspiring and really applicable to this group. And the thing that I really like about it is that it illustrates the importance of the action that you can take based on data that you have about your community. So I'm going to step back a little bit and talk about the data that the County Health Rankings and Roadmaps program provides for communities, and talk about some of the work that we do that can help communities, that can really drive communities to action. So as Travis said, my name is Karen Odegaard. I'm a Community Health Improvement Specialist with the County Health Rankings and Roadmaps program. I want to take just a moment to acknowledge the important relationship that we have with the Robert Wood Johnson Foundation. The County Health Rankings and Roadmaps program is a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute, which is where I sit here in Madison, Wisconsin. So here's just a quick peek at what I'm going to be talking about today. I'm going to start with an overview of the County Health Rankings and Roadmaps program, and then I'll spend a little bit of time demonstrating how you can use our site to explore your county's data. I'll also talk briefly about some tools that we have for taking action with a real quick look at the Roadmaps to Health Action Center and what works for health. So before I launch into this, Travis, I think we have a poll that we can launch to get at sort of an understanding of how folks have been using the County Health Rankings, or if they have been.
And that should be on everybody's screens now. If you just take a moment and let us know, have you heard of this County Health Rankings tool? That will be useful information for us going forward. We'll keep it open for another 20 seconds or so. Any more answers? Great. I'll go ahead and close that and share the results.
So Travis, I can't see the results real clearly. If you
okay.
could you let me know what some of those are?
Sure. So zero. Nobody has said what. So folks know, have heard of the County Health Rankings. 27% have said that they've heard of them. 45% of them have said that I've seen my county's rank and snapshot, but only 27% have used the county rankings in their work. So
Great.
Some knowledge, but opportunity to perhaps do more with the numbers.
Super. So I think as I go through this presentation today, those of you who have used your rankings and really built this into your work, feel free to, I think, share that in the question box. Share a little bit about your experience with it, and I think the folks, Travis and Kristen, Janet, can let us know what they're hearing or what they're seeing from the audience. For those of you who have seen it or heard of the rankings, this will be a great opportunity to think about how you can begin to leverage this information in your communities. So the picture that you see on your screen here shows a little bit about the thinking behind the rankings. Our theory of change about how rankings can be a catalyst for action that improves the health of everyone in a community. So we start with population-based data from a variety of sources, and we use that data to rank the health of nearly every county in every state. The rankings take several pieces of data and simplify them. They give communities a quick and easy snapshot of their health and the many factors that impact how well and how long people live. So each year, the rankings release, which is generally in March, generates national, regional, and local media attention. So some of you may have heard about or read about how your county compares to others in your state around the rankings release time. This provides an opportunity for people to tell the story of the many factors that are affecting health in the community. So this is the kind of that first point of action where community leaders can and do use the rankings release to get the word out to their community and to local media to help people understand the health status of their community. They can use the findings as an opportunity to mobilize multiple sectors to look further at their community's strengths and needs. And based on this deeper look at their unique priorities, community members can begin to identify evidence-informed strategies that they can implement locally to make change. Over time, these evidence-informed strategies ultimately result in longer, higher quality lives for all the children and adults in a community. So essentially, the rankings are really about a call to action. The county health rankings are a starting point for discussion in communities and not an ending point. Communities will want to dig into their own local data to further understand what's going on in order to know where and how to take action. So the horizontal portion of the model underpins the rankings. The county health rankings show us that where we live matters to our health and that a broad range of factors impact how long and how well we live. The vertical portion of our model underpins roadmaps, and roadmaps offers communities guidance, tools, and resources to move from awareness to action to create healthier places to live, learn, work, and play. So I'm going to start with rankings today. The County Health Rankings ranks the health of nearly every county in every state. For each county, you will find two rankings, one for health outcomes and one for health factors. We do this because we believe there are two separate sets of messages to convey. First of all, how healthy a county currently is. So we think about our health outcomes ranking, which you see in green. We think about this as today's health. But we also want to help communities understand how healthy they might be in the future based on the many factors that influence health. So for that, we look to our health factors ranking, which you see here in blue. And we call this, or we think of this, as tomorrow's health. So this is one of the most important images that I'm going to share with you today because it shows a couple of really key things. It shows what we use to determine the county health rankings and what influences health in a community. This model shows the relationship between policy, health factors, and health outcomes. It illustrates how multiple factors impact how well and how long we live. Things like how we commute to work, our housing conditions, access to parks, the availability of jobs and access to healthy foods, our social connectedness, all of these things impact our health outcomes. So if you think about Kerry's photo that she put up from the Robert Wood Johnson Foundation prize site visit, and she started naming all the different people who were sitting around that table who were working together to think about how they could improve the health of the city of Manistique. You can look down this model and start to think about who are the key players that impact each of these health factor areas. Who are the key players that have a role in health behaviors, who have a role in clinical care and social and economic factors and the physical environment. The other thing that I love about this model is, and I want to point out with this group, is that you can clearly see here, looking at the social and economic factors, things like employment and income, that the work that you do in communities to help families earn more and keep more and to grow the assets that they have over time is truly work to improve health outcomes in your communities. So I just want to take a moment to say thank you to you for the work that you do that plays such an important role in what we know impacts health. So if we just take a look at this model a little more closely, starting from the bottom, we know from research that effective local, state, and federal policies and programs can improve a variety of factors. So that's that orange box at the bottom that in turn shape the health of communities. And we know that there are many health factors that shape our community's health outcomes. We specifically look again at health behaviors, clinical care, social and economic factors, and the physical environment. We measure two types of health outcomes. Those are in the green boxes. to show how healthy each county is. We look at length of life and quality of life. So as an example, if you think about a community working to expand early childhood education to improve academic achievement, those higher levels of education can then lead to higher levels of income, which then influence other health factors, such as access to healthy foods, clinical care, and quality housing, which in turn will influence health outcomes. So there's this important interrelationship that happens between all of the factors that you see in this model. Stepping back, you'll note that we don't include race or ethnicity in our health factors. We have selected health factors that reflect aspects that communities can improve or impact. Race and ethnicity are not modifiable, while poverty is something that we can take action on. So you will see income as a key health factor. The bottom line is that factors such as one's race, ethnicity, socioeconomic status should not play a role in how healthy we are or how long we live. But unfortunately, for many people across the nation, they do. If we're going to build a culture of health in every community, reducing health disparities needs to be a top priority because everyone in our society deserves an equal opportunity to pursue a healthier life. So let's talk for a moment about that. As we talk about building a culture of health where everyone in a community has equal opportunity to enjoy good health, we are really talking about health equity. This means creating a sense of community where all individuals, especially those most affected by poor health outcomes, feel they have a voice and a role to play in creating and implementing solutions. Healthy People 2020 calls for valuing everyone equally, addressing avoidable inequalities, and eliminating health and healthcare disparities. So this includes a shared commitment to identifying and addressing gaps in opportunity that tend to disproportionately and negatively affect certain populations. Health equity is a basic principle that all people, despite race or ethnicity, limited English skills, gender, age, religion, income, educational level, geographic location, sexual orientation, despite all of those things, that they have the ability to have equal opportunity to lead a healthy life. So we've taken a look at the model. Let's think just for a moment about how we select measures. As I mentioned, we want communities to take action. So we use measures that reflect aspects of a community that can be improved. We look to valid, reliable, and recognized data sources that are used by other similar national measurement or rankings projects. So for example, many of our measures are used in America's Health Rankings, which annually measures the health of states. Our measures also must be available at the county level for every county in every state. And the data we use must be available at no or low cost and be as up-to-date as possible. We use fewer measures, so we try to limit the number of measures that we use. We used 35 in 2015 because the rankings are really intended to be a snapshot, and this data is a starting point for communities. So having looked at the model and the measures, we're going to take a look at a county example. What does it look like on our website? So this is our homepage, countyhealthrankings.org. And you can find information for your state and county by clicking on your state on the map, by entering your county name in the search bar below how healthy is your community, or in that main search bar in the top right corner. So if you go to Michigan, you'll see the health outcomes map on the left and the health factors map on the right. Both maps show how Michigan's 82 ranked counties compare to each other. On these maps, the lightest shaded counties are healthier and the darker shaded counties are less healthy. So as our example today, I'm going to take a look at Schoolcraft County where Manistique is, so you can see a little bit more about the data behind the rank. So this is the county snapshot for Schoolcraft County, and what I want I'm going to use this as just a way to get a sense of how the snapshot is laid out, and so you can see how you can apply the different types of data that you'll find here to your own community. So here you'll see that Schoolcraft County, again where Manistique sits, ranked 26th out of 82 counties for health outcomes in 2015 and 63rd for health factors. I'm going to walk through the types of data you'll find on your county snapshot. So in the first column, you'll find our measures. We have 35 measures in 2015, and because this is a screenshot, you only see a portion of the snapshot here. And we have 2 overall ranks. So again, that health outcomes ranking for today's health and health factors ranking for tomorrow's health. You'll also find ranks for each health outcome and health factor in the far column. Your snapshot contains 4 columns of data. First, you'll find your county data. Here you can see data specific to Schoolcraft County. Next, you'll see a trend column, and we're going to come back to that in just a moment. To the right of that, you'll see the error margin. We use a 95% confidence interval, and basically this means that we are 95% sure that the actual number for your county is in this given range. In the 4th column, you'll find the top U.S. performers. We include this as an aspirational value, as only 10% of counties in the nation do better than the given number. Finally, you'll see your state column. This allows you to compare your county's numbers to your state overall. So if we go back now to that trend column, for each measure where we have sufficient trend data available, you can see a detailed graph of that trend data by clicking on the graph icons. Before you get to that step, though, we have color-coded each of these icons to help you quickly see whether your county's estimate is improving, getting worse, or staying the same over time. So the red graph icons indicate that your county is getting worse for a measure, yellow indicates that your county is staying the same for the measure, and green indicates that your county is getting better for a measure. So if we take a look at the trend graph for adult obesity in Schoolcraft County, you'll see Schoolcraft's county trend is in blue, the state trend is in green, and the national trend is in orange. A little tip, if this is something, as you're looking at these trend graphs, if these are things that you would like to incorporate in your own presentations or in your own reports, you can simply right-click on this trend graph from the website and save that image to your computer. So that's just a little tip about how you can take these graphs with you. The areas to explore highlights potential challenges a community may want to examine more closely. So this is a feature that you can turn on your snapshot, and then orange boxes will highlight areas to explore based on health factor measures that seem to have the greatest potential opportunity for improvement. As with a county's rank, these areas to explore are really just a starting point. So here we can see that Schoolcraft County may want to look at additional national, state, and local data related to obesity and alcohol-impaired driving deaths to determine if these are areas on which to focus. From your snapshot, you can also find additional measures that may be useful to you, but that we don't use to rank your county. So a couple of things for rural communities to consider. Rural counties are more likely to see greater variability in their numbers. So using the trend graphs to see how a measure looks over time can be particularly helpful. It's also important to note the error margins. You'll find that they're often wider in rural communities. And then consider using additional data sources to verify data. So looking to what you know about your community, any data that's collected locally or by your state may be really helpful to verify if what the rankings is indicating is actually happening on the ground in your community. That includes qualitative data. and talking to the people in your community to understand what's most impacting them. Rural counties are also more likely to have suppressed data, so that may mean that when you're looking at your county snapshot, you may find that some of the measures are left blank. That's due to data being suppressed from the data source. So if we look at how rural communities compare to their suburban and urban counterparts across the nation, we can see some areas of strength and opportunities for additional impact. On average, rural communities fare better than their urban and suburban counterparts when it comes to factors like family and social support, community safety related to violent crime, and housing problems. But that comparison can also reveal some opportunities to impact factors like obesity, access to and quality of clinical care, and children in poverty. So the work that you all are doing around income can play a role in impacting impacting children in poverty. And so much of the work that we heard about from Manistique is really keyed in on addressing issues like obesity. I wanted to take a moment to highlight a couple of tools on our site that can be particularly helpful for understanding your data. Many communities around the nation are working to improve their health, but also trying to understand how they can measure progress. And there are lots of ways to do this. So we've included some guidance on our site to help you see if you're on the right track. A couple of key things about this tool, measuring progress, is that it helps you remember that you can use ranks as a tool, and they're great for garnering attention and simplifying a lot of complex data. But they alone should not be used to measure a single community's progress. So looking at your rank over time to measure progress is not particularly helpful. It's also really important to remember that change in data can take time. So there's two things there. There's a point that seeing a change in the data that is before you takes a little bit of time, but also noting that there's often a lag in data. So knowing that you won't see any changes for a period of time. Another key tool is called Using the Rankings Data, and this can be found on the main orange navigation bar on the ranking site under the Rankings tab. And it can help you find and understand the data both on our site and beyond as you begin to assess your needs and resources and focus on what's most important. This is a fantastic tool. It includes examples of how other communities are using the rankings. It includes ideas for additional questions that you might want to ask based on your data, as well as points you to some additional data sources. So it's a really rich tool. So hopefully that will help. That little demonstration and overview helps you feel comfortable finding and using your county snapshot. I want to just briefly bring us back to the thinking behind rankings and roadmaps, and talk a little bit more about how the roadmaps work can help your community. So basically, now if you think about the rankings as helping to garner your community's attention, roadmaps can help us find the best possible strategies to impact your community's health priorities. So this is where communities take action to improve health. But how do we do this? From working together to evaluating your efforts, the Roadmaps to Health Action Center provides a variety of tools and guidance to assist communities in taking action. The Roadmaps to Health Action Center is an online platform that provides practical help for communities working collectively to improve their health. It provides guidance and tools to understand data and strategies that communities can use to take action. The Action Center also provides access to community coaches who will work with your community at no cost. So the best way to get in touch with a community coach is to use the Get Help button On the left, upper left of the Action Center page, you'll find this button throughout the Action Center as well. And that'll take you to an email form that you can give us a little bit of information about your community and the work that you're doing, your questions that you have, and that will end up, that will go to a coach directly who can be in touch with you and help you think about what resources from rankings and roadmaps could be helpful to you and whether coaching is a good fit for your community. I want to touch briefly on another really important tool, and that is What Works for Health. What Works for Health provides communities with information to help select and implement evidence-informed policies, programs, and systems change that will improve the variety of factors that we know affect health. What Works for Health can also be found in the Roadmaps to Health Action Center, and what this is a database of more than 300 different strategies that are rated based on their evidence of effectiveness, and that communities can look to think about what might work best in their community. I also just want to take a moment to talk again about the Rwjf Culture of Health Prize. So as we mentioned, as Kerry mentioned and Travis mentioned in his introduction, Manistique was one of our inaugural Rwjf Culture of Health Prize winners. The Culture of Health Prize honors and elevates U.S. communities that are making great strides in their journey toward better health. So on this slide, you'll see the 6 criteria that are central to the Rwjf Culture of Health Prize, which is also a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. The prize recognizes and celebrates communities that have placed a priority on health and are creating powerful partnerships and deep commitments to make change that will enable all in our diverse society to lead healthier lives now and for generations to come. The prize is awarded annually by the Robert Wood Johnson Foundation, and communities that are awarded the prize work across the various health factors by defining health broadly. They are strategically focused on policy, systems, and environmental change, and are making sure to look out for all, including the most vulnerable in their community. These communities work collaboratively with partners from across the sectors. They use resources wisely and creatively, and measure and share success widely. So you can learn more about our 2013 and 2014 prize winners at www.rwjf.org/prize. You can also tune in to a live streaming webinar on October 28th, so just a few weeks from now, on that same site. That's www.rwjf.org/prize to hear about our 2015 winners. We'll be doing a live announcement via that website on that day. So that's really exciting coming up. You can also consider applying for the 2016 RWJF Culture of Health Prize. So you can learn more about prize eligibility, criteria, the selection process, key dates, and begin your application process again at that same website, which is now on your screen. 2016 applications are due on November 12th at 3 p.m. Eastern Time. So I hope that you and your communities will consider whether a prize application makes sense for you. I just want to take a quick moment to acknowledge that this program is the result of the contributions of many partners, including those who are listed here. And thank you so much for having me on today, Travis, and to your colleagues. I really appreciate the opportunity, and here's more information about how you can stay in touch with us.
Oh, Karen, this is wonderful. Thank you so much for walking us through that, and I suspect that a large number of participants are now at countyhealthrankings.org looking up their rankings and perhaps going over to the Robert Wood Johnson website and figuring out if they can apply for the prize. But what's great now is we have a few more minutes with you here and Kerry, with you if you're still on, to just kind of take some questions, and there's a lot of information about data there, so if folks want to kind of ask some questions about getting into the data, we can do that, but also welcome broader questions and questions that go back to Kerry's story that started us off. Go ahead and please type those questions into the question box. Go ahead and type those questions into the chat, or feel free to be brave and raise your hand, and we'll unmute you and bring you into the conversation. One of the questions that I have right off the bat is coaching assistance is really remarkable if you can take advantage of it. Can you just talk briefly about what does the coaching assistance look like that you all provide, and what would a community expect if they were to call you and ask for that?
Absolutely. It's one of our really great resources and something that we're really proud to be able to offer, again, thanks to the funding from the Robert Wood Johnson Foundation. Travis, I popped up on the screen our website, and I wanted to just take a moment to show folks where they can learn more about coaching. So if we go to Roadmaps to Health here on the main navigation bar, you can go right into Roadmaps to Health coaching here and learn more about Roadmaps to Health coaching offers, what's required to work with a community coach, a little bit about where we are. We have 11 community coaches based here in Madison and across the country. And a little bit more about what to expect here. So this is a really fantastic resource if you are interested in coaching. I would start here and then move quite quickly over to the Action Center, where you can use that Get Help button to be in touch with us direct here. So it's a wonderful opportunity. It looks different in communities. It can be a short few exchanges with a coach, or it can be a longer-term coaching relationship up to a year with a coach. So typically we work with teams in communities, but it can also be with one or two people, especially on those shorter-term coaching relationships where it's really just answering a few questions or having a couple phone calls or email exchanges.
Travis?
Travis, that's a great question.
Yeah, go ahead, Janet.
This is Janet. I wanted to ask a question of Kerry, and if Kerry used, I'm not sure what the connection is between the County Health rankings and what Manistique did. Is there some way, Kerry, that you use these rankings to really get your work going or to advance your work?
Well, Janet, we've been using them since they first came out. Was it 2010, I believe, that the County Health rankings came out, and we use it not so much that we can, as Karen was talking about, we don't claim to show any correlation between the work we do and any improvement whatsoever in the health of our population. One, we've not been at it long enough. Two, we just don't have that level of data to be able to show that. But we use it as a conversation starter, and we use it as an opportunity to show people where we have a lot of work to do. The County Health rankings, as Karen and Travis both said, it frames it in a nice way that it's easy. It's packaged in such a way that it's easy for people to look at it and say, oh, wow, that really is a problem. It kind of reaffirms what we see on a day-to-day basis and what we think are the issues, the health issues, the economic issues that face our population. They kind of give us that foundation. And that's the other thing I wanted to address, is because we are rural, we have to be very cautious with the data because our numbers of population are so small that it's not something that we can always rely on completely, but we use it as a good conversation starter, and it certainly helps us understand the trends and the challenges that our people face in our area.
And that was an interesting point, because I think when you all first came together with your presentation, I wrote the first draft of the invitation to join this webinar saying, look how fantastic the numbers have improved for Schoolcraft County. And you both rightly said, well, we can't definitively connect that with the work that's being done on the ground. So in a sense, there's some places that people need to be careful about using this data to draw conclusions about specific interventions, and maybe that highlights the importance of, if you're ready to take action based on this data, it's worthwhile to reach out to somebody at the University of Wisconsin Population Health Institute to just understand your community's numbers while you're acting. Makes sense to me. Jason Gray added an observation that can you go a little bit, Karen, maybe into the rankings methodology? You were talking about how different factors in a community are weighted differently in your framework. Jason was pointing out that in the weighting, clinical access is far less important than health behaviors or socioeconomic factors. Can you just, and I don't know if you know this right now, but can you explain the difference in those weightings in the framework that you have?
It's a great question, and I'm going to try to go back to my slides. Every time I touch something on my computer, I feel like I lose my audio connection, so I don't want to do that again. But let me see if I can move back to that slide. So everybody, if you didn't notice that, because I didn't talk about it, I want to just let people take a look at that slide. So you can see that there are different weights, as Jason has pointed out. The health behaviors is weighted at 30%, clinical care at 20%, social and economic factors at 40%, and the physical environment at 10%. We have based these weights on research that we've done, on the literature that we've reviewed, but there isn't really an absolutely correct, this is exactly how these are weighted equation, if you will. But this is our best guess, or our best, based on our research and our work, the work of others, this is where we've landed on weights. And really seeing that those social and economic factors are so incredibly important. And the other thing to acknowledge is that there is a lot of interplay between these different factors as well. If you really want to dive into this, we do have a white paper on our site that I can share that link, the direct link to it, with Travis, and he can share it with all of you, that dives in a little more deeply to how we came up with these weights, what they're based on, and a little bit more behind those weights. But really it is based on the evidence that we've reviewed, the research that we've done ourselves, and the research that we've seen from elsewhere, that these are the weights that we've landed on for how these different factors impact health outcomes.
Hey Karen, this is Janet, and I'm going to unmute Jason to see if he can affirm what I'm saying. But the way he wrote this in the question box, it sounds to me like he said, isn't it interesting that social and economic factors and health behaviors are weighted more highly than clinical care, like access to care and quality of care? Because what often happens is when we talk about healthy communities or the health of people in communities, rural or urban, we always think that health is determined by clinical care as opposed to other things. And it's just really interesting. Jason, I unmuted you, or maybe I shouldn't have. Would you affirm that or deny that, Jason? Are you on speakerphone?
No.
I'll mute you back, Jason. Didn't work well. Never mind. It's easier if you're on the phone on that. Oh, he says he doesn't have a mic. That's what he said.
Oh.
So I think that's I think that's the case.
Yeah, I'm going to play off of that, Janet, because I think that is really an important point, and it's one of the key messages of the county health rankings, is that health is more than what happens in your doctor's office. There's so much more at play that impacts our health, and those social and economic factors so often are kind of left out of the discussion about health, which is why I think that the work that you all do is so important and is really critical to improving health outcomes in your communities. So I agree, and it's been a big part of our the message that we've been trying to bring to communities is to help them think about how they can get into working on those social and economic factors that are so important to our health outcomes. But you know, I want to also note that all of those health factors are important. And when you think about, if you think about the prize, for example, the Rwjf Culture of Health Prize, we're going out and we're looking for communities that are defining health broadly, and that means that they are working across those health factors. And certainly not leaving those social and economic factors off the table.
You know, it reminds me of one of the things that Kristen and Travis and I, my colleagues here at Aspen, and I heard recently. We were working with the Appalachian Regional Commission on developing their 5-year strategic plan, and we had a listening session with a bunch of people from around Appalachia that were involved in the healthcare system. And we asked them, well, if you were going to measure the effects of what the Appalachian Regional Commission does to improve healthcare, what measure would you use, right? And they said, and I'm not making this up, labor force participation, right? In other words, they would think they were successful in their healthcare work if the labor force participation number went up. So they think a direct outcome of improving health is more people working, which is another way of really connecting the importance of health to economic outcomes. Absolutely.
That's a great story and great recognition on their part to understand that relationship and how that really they impact one another.
Including Kerry's story about how their work on a farmer's market was also then helping the economy in the local community, which was really wonderful. And I think you would go on to say that the advantage of these, you've given these things these rankings, but for each community, you had said you've also provided a sub-ranking within each of these categories. So if you want to see how you're doing on clinical care in the data, if you want to see how you're doing on health behaviors, you can parse that out and find that information on your website, which is really useful for folks. If there are any other questions, please go ahead and chime up now. We're running low on time. One question I do want to ask, and not to curry any favor, I wouldn't do that, but I see that the deadline is approaching. Is there any tips or advice you could give to folks on the call if they're interested in applying for the prize? Anything that they should focus on in their work?
So I would say you can go, I would spend a little bit of time on the website, the rwjf.org/prize. You can find an archived webinar there that really goes through those prize criteria and helps you think about how they may or may not apply to your work and really think about whether this is a good fit for you. Those prize criteria, I think also, I love to look at them as a way to think about how you're doing your work. So if, I'll put them back on the screen, whether you decide to apply or not, I think that they're a great tool to use to think about, are we doing these things? When we think about our work in our community, what does it look like, and are we defining health broadly? Are we committed to sustainable systems changes? Thinking about how the work that you do fits these criteria, and if you decide to apply, then great. And I think going back and watching that webinar can be really helpful. And if you decide that this is something that you want to think about in the future, then using these prize criteria to think about how you do your work and what you're working on can be really helpful.
Hey, Travis, this is Kerry.
Travis,
can I address that?
Go ahead, Kerry.
Okay. I've written a lot of grant applications, and they're typically very dry and very formal. But when I wrote the prize application for Manistique, it was great fun for me because it was telling a story of the process and our successes more than a data sharing type of application like a lot of grants are. And we got to focus on the positive, where a lot of grants you focus on the negative. It was telling a story, and I enjoyed that application more than anything else I've written in that kind of work. So people should look at it as an opportunity to tell their story about whether they feel like they have that kind of positive story to tell.
I think that's such a great point, Kerry, and you know, I think you may be able to, you are in a better position to speak to this, but I know we often hear from communities who have applied and gotten to various stages in the application process for the prize, who have said that this process, the process of going through the prize application is really rewarding, because it helps you bring people together and to think about how are you going to tell your story, and what do you have to celebrate, because it's not deficit focused, it is focused on the things that you have accomplished in your community, and so it's a really great opportunity to celebrate that.
Exactly. Well said.
If I could just throw one thing in that I think what was sort of, you know, it's been talked about, but it's sort of critical. So Kerry sort of talked about how using the county health rankings was really critical to sort of helping them think about their place, and it was sort of a motivator to getting working. But in terms of collecting data locally that brought in more local partners, you sort of did that on your own, because you couldn't use the county health data to sort of prove to your Chamber of Commerce that the farmers market was making a difference. You had to collect your own data. So it's really important to think about how do you, as you begin to do this work or continue to do this work locally, how do you develop data that is going to bring in more partners, or that's going to cement support in a way that makes the effort sustainable and able to grow over time?
Exactly.
Well, this has been a really wonderful conversation, and Kerry, thank you for joining us from Manistique. It's been great to have you on your day off. I'll let everybody know. And Karen, we really appreciate your being here to talk about the wonderful work you do with helping communities improve their health and in so many different ways. So thank you for joining us. And thank you all for joining us today. As we said during the presentation, this video will be posted to YouTube in the next few days so that you can come back and watch this presentation, as well as the materials and resources that we've listed will be available on the RuFES.org website on the post that originally advertised this webinar. Those resources will be available there. As always, my colleagues here at the Aspen Institute, we like to say that we're the greatest fans of your work. We'd like to hear about the work you're doing and stories like Manistique. So email us your stories, and perhaps they could be featured on a future webinar. At the beginning, we mentioned that we tweet #RuralFamilies. Please go ahead and tweet to spread the message of great stories like this, and we will retweet you. And after the webinar, there's going to be a quick survey about what you thought of today's presentation. Give us your feedback. You can also send your comments to CSG, the csg.program@aspeninstitute.org. Again, thank you all for being here. This has been wonderful, and